Hello and welcome to the Stem Cell Healing Institute podcast. In case you have any questions, please send us an email to info@stemcellhealinginstitute.com. Thank you and enjoy the podcast. Hello and welcome to the Stem Cell Healing Institute podcast. We are here once again with Dr. Figueredo. How you doing, doctor?
Very good, Luis. Thank you. How are you doing today?
I'm doing great. So, doctor, we do have an interesting topic today, which is cardiovascular disease and how the stem cells can help. I've been doing a research here, and I noticed that cardiovascular disease is the leading cause of death globally. Is that correct, doctor?
That's right. It is very, very rampant, predominant in our culture and globally, with so many factors contributing to cardiovascular disease, which I'm sure we'll go into.
Yeah, so we can say food, stress, and everything, even drug abuse and alcoholism and
Right.
smoking. So, what are the main causes of all these heart diseases, doctor?
Yes. So, as you mentioned, some very good causes of heart disease. There's diet and environment, of course, and then processed foods. And, there's a misnomer with cholesterol. Our bodies actually require cholesterol. So, it's not necessarily the cholesterol in foods, it's how the cholesterol interacts in our body with inflammation. And so inflammation is the problem. So we really need to control inflammation with, and that could be a completely different topic for a video and a podcast. But inflammation is so important in athero and arteriosclerosis, which is the plaques in the arteries. Keeping inflammation at bay, stress that contributes to inflammation, as well as hereditary factors. Liver and kidney disease can contribute to heart disease, diabetes, metabolic syndrome. So there are various different causes, and drug abuse, like you mentioned as well. Various different causes of heart disease, and they can manifest in different ways as well.
So, what exactly happens when the heart muscle suffers damage, doctor?
Mm-hmm. So, usually the heart muscle suffers damage due to a lack of blood supply. And that's what we will call a heart attack. Okay. When a heart attack happens, a clot or somehow blood and oxygen, a part of the heart is being deprived of blood or oxygen ultimately. And so that leads to necrosis of the tissue of the heart. And necrosis means death, basically. So death to cardiac cells. And that's what accounts for the pain. And sometimes the heart, it eventually ends up in that there's arrhythmia of the heart, or an abnormal heartbeat, or atrial fibrillation, ventricular fibrillation sometimes. So it again, as I was saying, it ends up in manifesting in different ways. But that's essentially what a heart attack is, or when there is damage to the heart.
In this case, doctor, how the stem cells can help a patient suffering heart disease, and how does the stem cells know where to fix the problem?
Right. And how do they know where to go?
Yeah.
Stem cells can do so much. So they help modulate inflammation. We talked about how important inflammation is in all diseases, actually, as well as causing angiogenesis. So stem cells help with angiogenesis. Now, what's angiogenesis? Which is really important in, say, stroke patients, any kind of organ damage, and in this case, cardiac damage. Angiogenesis is when new blood vessels are formed. And this is really important because when there is a lack of blood supply and damage to an organ or tissue, the new blood vessels help to regenerate. They come in and sort of help regenerate the damage, help regenerate the tissue, bring new life. And so, with the addition of stem cells, angiogenesis, the goal is to regenerate the damage and to build up that tissue that's been damaged.
I see, doctor. And what will be the stem cells, the type of stem cells that you will use in this case?
Mm-hmm. So we will use endometrial stem cells, which are from a young female uterus, as well as brand new non-toxic bone marrow derived stem cells that are grown in vivo. We have a proprietary method of growing fresh, brand new non-toxic stem cells at really high numbers. It's really important that we have the numbers for regeneration to occur, especially in the cardiac cells. And it's really important that we get those cells at the site of injury, which is so important. So we use certain measures to get the stem cells at the site of injury. And you also mentioned how the stem cells know where to go. So I mentioned inflammation. And what happens is when there are damaged tissues, so for cardiac cells, for instance, for any other organ, there are specific cytokines or inflammatory markers that signal to the stem cells that this is where the damage is. It's this tissue here. And so the stem cells know exactly where to go in order to regenerate and reconstruct the tissue or organ.
So in the case one of our patients have a pacemaker, would they be a candidate as well to receive stem cells?
Absolutely. Yep. There's no contraindication with pacemakers or even prosthesis for that matter. The only thing that it could affect is if we choose to use, we use exercise with oxygen therapy or hyperbaric oxygen therapy. A patient with a pacemaker would not be a candidate for hyperbaric oxygen therapy. So in that case, we would have to opt for exercise with oxygen therapy. That would be the only limitation. Otherwise, a patient with a pacemaker would actually be a very good candidate for stem cells for cardiac regeneration.
And you do have a very comprehensive treatment that you don't only provide the stem cell treatment, of course, but you go deeper as far as this, the well-being of the person. And what else do you investigate in this case about the patient when you do your treatment?
Mm-hmm. You know, it's so important that we get a thorough medical intake, get an idea of the patient's lifestyle, hereditary factors. We address diet and nutrition, key supplementation, detoxification, as well as I mentioned, the exercise with oxygen therapy or hyperbaric oxygen therapy, which goes in and helps with rejuvenating and regenerating in and of itself with oxygen. We look at hormone therapy, age-appropriate hormone therapy, as well as certain key cocktails in our stem cell enhancement formula, as well as, we don't want to negate looking at the patient's psychological, emotional, even spiritual well-being because of stress and other factors. Our body cannot differentiate between an emotional pain or a physical pain. So stress is like an emotional pain. So it has a great effect on our bodies, the cortisol, in various different ways with inflammation and so on and so forth. So we have to address all of these factors in our well-being. And this is what we do at the Stem Cell Healing Institute, and we do it very effectively.
Do you do these treatments by yourself, doctor, or do you have a team that will help you out with these type of patients?
Absolutely. Yes, we have a team of specialists that are specialized in their respective fields. So we have cardiologists, we have orthopedic surgeons, we have anesthesiologists, we have ophthalmologists when necessary, various different the team includes various different specialties, which is really important because not one person can do it all.
So, doctor, what is the connection between cardiovascular disease and liver and kidney disease?
There isn't a direct connection, but a lot of these are involved in certain disease conditions. So, for instance, I mentioned diabetes. Diabetes, or that might have been another podcast, but diabetes, for instance, and metabolic syndrome, when we see high blood sugar, high insulin, we see inflammation. Inflammation can result in heart tissue damage and atherosclerotic plaques and so on and so forth. And again, I like to use diabetes because it is so prevalent in society. And so with high blood sugar, high insulin, high inflammation, we see damage to the kidneys and the liver, as well as other organs, the eyes. We see erectile dysfunction. This is all related. So a lot of times when we see one of these, there's almost always another organ involved as well. So if we didn't have diabetes, let's just say we had a clotting disorder, and we see a clot that results in heart failure or heart attack. We may see other clotting in other organs that may cause hypoxia or necrosis of other tissues and organs as well. So we would have to address the whole body. In our work, we address the body as a whole, not just symptoms or a disease condition.
I see, doctor. And these treatments are done in Guatemala. We already mentioned that in previous podcasts. But can we give a sense of what's the Guatemala City it's like, doctor?
Mm-hmm. Yes, we get a lot of positive feedback with patients that are very pleasantly surprised at how advanced and first world for or developed Guatemala is. And so we have all of the fast food chains for people that want to know, but
no for cardiac,
not for cardiac patients. But we provide very, very pleasant accommodations with the stem cell treatment, as well as a driver. We have all of the amenities that anybody would be looking for when they travel. We have a lot of beautiful landmarks for visiting and sightseeing, including active volcanoes and coffee farms and ruins. And so it's a very, very, it's considered a destination spot for our patients, as well as just people that want to vacation.
Yeah, and I want to add that you will find a lot of malls and supermarkets, ATMs everywhere. So it's a very modern city, and you will spend a good time here in Guatemala City for sure. Our clinic is also located in one of the most residential areas in Guatemala City, so you will feel comfortable and safe here. Doctor, I don't know if I missed anything.
No, I think we've covered a lot of ground today, Luis.
All right. Thank you very much for your time.
Thank you.
You
Have a
take
good
care.
one.
Bye-bye.
You too.
Thank you for listening. In case you have any questions, please visit our website, stemcellhealinginstitute.com. Or you may send us an email to info@stemcellhealinginstitute.com. If you want to contact us from North America, you may dial +1 209 690 7836. If you want to send us a message through WhatsApp, please add us at +502 4220 7297. And this is how you find us on our social media. On Facebook, Stem Cell Healing Institute. On Instagram, Stem Cell HI. On Spotify, Stem Cell Healing Institute. On YouTube, Stem Cell Healing Institute. We hope to hear from you. Thank you.